Hello, everyone. So today we're going to be talking about the power differential that's inherent in therapeutic relationships, as well as transference and countertransference. A lot of the information today is going to be out of Chapter 2 of the 8th edition of Mosby's Fundamentals. Some of it is not, but a grand majority of it is if you would like to read more on the topic. All right, so what is a power differential? So we have power differential. There's a difference in the level of power that we're experiencing in a relationship. In the therapeutic setting, specific parameters define the professional relationship between the client and the massage professional, or between the patient and the doctor, the patient and the nurse, or even the student and the teacher. In the therapeutic relationship, there is an inherent power differential, which stems from the difference in knowledge and skills between the client and the professional. So the client is coming to seek knowledge from the professional. This is what they're paying for. They want to get worked on by the professional. Even when services are exchanged between peer professionals, say two massage therapists graduated from the same school at the same time, they're working for the same employer on the same level, but one is giving the massage and is in the position of control of the situation, and the other one is paying for the services. There is an inherent power differential still, even in that relationship. This power imbalance must be minimized as much as possible to give power back to the client without denying its existence. In body therapy, such as therapeutic massage, the client's physical position often creates an environment that fosters a power differential. Clients usually lie down or they are seated, and the professional is standing and physically above the client, generating the impression of authority and dominance. I don't know if you've ever heard child psychologists or pediatricians talk about, when you're dealing with kids, if you want them to feel like you respect them or relate to them, to sort of get rid of that feeling of authority and dominance or aggressiveness in a conversation, you should always kneel down and get on their level so you're eye to eye. If you're ever talking to a disabled client that might be in a wheelchair, you always sit down at their level so that you are eye to eye talking, to eliminate a lot of that power differential that being physically domineering can bring into the situation. So since this power differential exists, there are some duties. We've talked about practitioner duties before and some client rights. As a practitioner, you have to take responsibility for maintaining those professional boundaries. All right, you need to use your own authority, your own power in this situation to enhance and never endanger the client's well-being. All right, we've talked about beneficence and non-malfeasance. You need to stay aware of how that power differential is affecting the client. Do they feel safe and that they have autonomy? All right, we've talked about the term autonomy before. Do they have the right to speak up and voice their own informed consent about what you can and cannot do to their body? And again, number 4, respect that client's autonomy. All right. The client has the right to benefit rather than suffer from the professional's authority. They also have the right to remain free from interference with their autonomy and self-determination. So if a client, we've used this example before, wants a relaxing massage and you notice that they have a rotator cuff injury or an issue with their foot or their posture, and you're really excited to work on this issue because you think you can help them. Well, they didn't want you to focus on that. They want you to focus on giving them a relaxing massage. If you take away their autonomy and begin doing deep tissue or trigger point release or some myofascial release, stretching, whatever it is on that problem body area that you noticed during assessment, you have used your authority to take away their autonomy and self-determination about what they wanted with their body. So, in an ethical massage practice, the power differential exists to bring benefit to the more vulnerable individual. In this case, it would be your client. Healthcare professionals are held to higher standards than others. They are coming to you with their very life, their body in your hands. All right. There's power differential in any relationship with you have. When you go to a store, the cashier has the power to tell you how much things are. Granted, they're ringing it up on the register, but they have the power to tell you what something is or potentially help you if it's on sale. The practitioner is always responsible for maintaining professional boundaries, even if the client requests or instructs the practitioner to behave otherwise. A lot of times, clients will become overly intimate in this setting. They'll want to share personal details with you, or they misconstrue the physical touch as intimate touch rather than therapeutic touch. It is always up to the practitioner to maintain those professional boundaries. Speaking of sales and cashiers, the inherent power differential becomes a sticky situation when you are trying to sell products to your clients because of the perceived authority that you have as a massage therapist and the influence that you can exert on your client. Closely related products to massage therapy, like self massage tools that are available for the client's convenience to use at home in lieu of the massage, are usually pretty good as opposed to products sold specifically for profit or for something else. The client may really like the services of the massage therapist, but now they don't want to feel pressured into buying products that they don't necessarily want. These situations need to be managed with careful reflection because ethical dilemmas often result from the sale of products, especially if the client gets something that they don't necessarily need or want, and they start to hold resentment against the massage therapist who they want to continue seeing as a client. This becomes more of a problem when you're pushing sales in a private office or when you are expected to meet a certain sales quota working for some franchise spas. So, there are some client expectations entering into this relationship with a massage therapist. They will expect the massage therapist to be professional and confident as a massage therapist. Nobody wants to go to a doctor that has to look everything up in front of them or is really unsure of what's going on in the office. That doesn't give you a lot of confidence in their skills. The same thing goes for massage therapy. They expect you to be skilled as a teacher of self-help methods, for you to be able to do things at home, to be personable and friendly, but not a friend. Clients also expect that massage methods address their outcomes, such as pain or stress management. It is super important for massage therapists to assess for realistic and unrealistic client expectations because sometimes we have clients that expect miracles that we absolutely cannot provide. You need to inform the client about the importance of expectations related to the therapeutic relationship and the benefits of massage. You need to make sure that the clients have realistic goals because they will be much more satisfied when you are able to reach those realistic goals rather than being unable to reach unrealistic goals. If those unrealistic expectations are allowed to develop, therapeutic relationship issues can perpetuate. They could even potentially report you or claim that your advertising is fraudulent. And there is a lot of situations that could arise from that. So make sure that when you are doing your intake, and we will talk about intakes and proper communication at a later date, but please understand that client goals are incredibly important to understand and to make sure that you are keeping that client on a realistic level. So there are some complications of power differentials in the massage office. You could misuse your power in an attempt to help, telling them of particular people that they need to go see for referrals, a misuse of power for personal gain, such as trying to coerce your client into buying particular products, or the disempowerment of clients, such as you've removed their autonomy. You have told them that they need to have their shoulder worked on rather than giving them this stress relieving massage that they requested. All right, now we're going to dive into transference and countertransference. All right, so issues of transference and countertransference truly can create issues within side of the therapeutic relationship. When a person seeks out a professional, There's an issue of that power differential, there's rapport and trust, there's control going on in this. All of this becomes the professional's responsibility to make sure that you are maintaining professional boundaries and making sure that the client does not misconstrue the closeness of the situation for true emotional or physical intimacy rather than therapeutic touch. All right, clients often seek a sense of control outside of themselves to help reestablish or replace their loss of an internal sense of control. So the client is in a vulnerable state when they do this. They're coming to you from a place of emotional or physical pain that they want help with. They want help with their stress or anxiety or their physical pain. The more someone is ill or under considerable stress, they become vulnerable to your power that's inherent in this therapeutic relationship. Transference is the personalization of the professional relationship by the client, usually because they are seeing you as this benevolent caregiver. Perhaps they have misconstrued this therapeutic touch as intimate touch, and they start to romanticize the relationship even when there is no romance involved in it. There's some type of emotional or intellectual boundary that is being crossed here. Transference occurs when the client sees the therapist in a more personal light instead of a professional one. If the client becomes dependent on the professional, massage therapist, they start to build these unrealistic expectations that we talked about before. But instead of considering that the massage is going to be an absolute miracle, they might expect you to start doing things for them that are a little bit outside of that massage parameter. If those expectations are not met, that person might start blaming you as the massage therapist. If they are met or exceeded, then they may start giving you tons of credit instead of acknowledging their own efforts. Like if a client starts drinking more water and stretching more, and they're starting to see a lot of physical benefit in their body, they're going to think that your weekly massage or bi-monthly massage is just absolutely curing everything without realizing what they are doing themselves at home. That professional then takes on these superhuman powers in the client's mind that sooner or later is going to crumble, and it leaves the client not only disillusioned but disempowered because they can no longer trust their own judgment in this therapeutic relationship. So, clients that have a lot of issues with pain management, functional movement issues, and they maybe have performance goals, maybe you're seeing athletes, they're more likely to schedule on a regular basis and they will make up the majority of your clientele in a retention based massage practice, right? When you're trying to get those repeat clients coming in. A therapeutic relationship with these specific types of clients is more prone to boundary issues, and the more disorganized or disempowered and lacking in internal resources, like the more stressed or anxious some of your clients are, the more susceptible they are to emotional transference. Managing transference is a common ethical dilemma in the massage therapy office, and the massage professional needs to understand and separate the client's appropriate, genuine feelings from transference issues. So, for an example, if you are late as a therapist to an appointment over and over again, a client is going to get angry. That's not transference. But if you remind a client of an uncle that always yelled at them as a child, and they start to get upset with you because they're remembering this uncle and you feel to them like you are a little bit like this uncle, that is transference. The client may also genuinely appreciate your skill as a massage therapist, and they might express that appreciation, but that doesn't mean there's any transference unless it starts interfering with the boundary in the therapeutic relationship, like exclaiming that only you can fix them and you need to tell them what's wrong with their body rather than letting a physical therapist or doctor diagnose them. The massage professional always has the ultimate responsibility for the therapeutic relationship and the direction of the therapeutic process. All right, so what are some signs of transference? The client could start calling you on your cell phone or at home, even though your policy states that they need to call the front office of wherever you work to schedule some type of an appointment with you. After only one or two treatments, the client starts being extremely complimentary of your work and talks about how wonderful you are all the time. The client keeps trying to bargain with you for a reduced rate. Now, this might happen if it's someone that tries to bargain for reduced rates everywhere, doesn't have a lot of money, but feels they really need a massage. So, this is kind of a gray line. But if they continue to do it after you have clearly stated your policy and that you will not budge on it, this becomes a boundary issue and could become a transference issue. If the client regularly requests that you accommodate their schedule by changing your schedule to work at a time when you don't normally see clients, this is a time boundary crossing. Remember, we talked about time boundary, but this could also be an issue of transference. The client develops a crush on you or any type of romantic feelings or seems overly attached or consistently brings you gifts or things that are potentially inappropriate. These are signs of emotional transference. The client could also repeatedly invite you to social engagements like going out for coffee or coming to see a movie or coming to a family event, and then they feel rejected when you explain your policy of not socializing with clients. At the end of most treatment sessions, the client will ask you to do just a little bit more and expresses disapproval if you don't comply and go over your session time. The client might ask you to help them solve personal problems. Again, I always tell you, you are a touch therapist, not a talk therapist. All right. The client frequently asks you questions in areas that you have previously explained aren't in your scope of practice. Do not get in legal trouble because this client is crossing professional boundaries. The client might mention that you remind them of someone, all right? Maybe not the angry uncle, maybe of their ex-wife, something like that. So be careful of this. That is a slippery slope. Or the client has difficulty maintaining a physical boundary and attempts to inappropriately hug or touch you at the end of each treatment session. This might be someone that's overly touchy-feely. Maybe it's an older woman that wants to hug. Maybe it's a creepy man trying to give you a hug and grab other things because they've mistaken physical intimacy for therapeutic touch in the massage office. But these are things to keep an eye out for. Another thing is a client having great difficulty leaving after the sessions and tries to engage you in conversation. Now, these may be lonely individuals. One of our primary goals is to create a safe environment for our clients. And perhaps you're one of the only safe spaces that your client has. So, this might not be a transference issue. This may be a genuine cry for help in some type of manner from this client. Or the client can give you details of their personal life which feel too intimate and make you feel uncomfortable. I know I've brought up verbal diarrhea quite a bit. A lot of clients become overly talkative, and a lot of people tend to overshare in these intimate settings. You know, they're not looking at you, their face is in the face cradle. So it sort of feels like they're just talking to a friend in a warm, dark room, even though it's the case of them being treated by a professional in the office. It does get this feeling of emotional intimacy because of the physical intimacy of the situation. So please be aware of that and know to cut it off and keep your professional boundaries. All right, so that was transference. Now we're going to talk about countertransference. Countertransference is the inability of the professional to separate the therapeutic relationship from personal feelings. All right, transference is the client feeling some kind of way about the therapist. Countertransference is the therapist feeling some kind of way about the client. All right, it's the professional's personalization of the therapeutic relationship. Countertransference presents itself in feelings of attachment to the client, such as excessive thinking about a client between visits, a feeling of professional inadequacy if the client does not make anticipated progress, or a sense of the client as being special, or sexual feelings developing. It can also manifest as favoritism, anger, or revulsion towards a client that maybe the client had nothing to do with contributing to those feelings. Countertransference usually comes from a place of personal need that is not being met in the therapist. Like if you are someone that is a fixer, you want to fix people up. Do you get into relationships with people that you're constantly helping out? The need to remove pain and discomfort from your own life often can project onto others where you're constantly trying to help them relieve their pain and discomfort. The need to be perfect, you want to show that you can heal everybody. The need to have the answer, hey, I see this wrong and I can fix it and let me tell you how. Or the need to be loved. You want adoration from your client to fill that need in yourself. Sometimes the client's problems may serve as a reflection of the professional's personal life experiences. So you need to make sure that you are self aware of your own life and issues and that you focus the massage session on the client's physical need and meeting the goals of the client so that it doesn't shift to talking about the client's personal life and then now you're trying to meet the goals of the therapist in their personal life. You might lose objectivity and empathy in the therapeutic relationship. All right. During appropriate therapeutic interactions, a bond can form between the therapist and the client. Some people call it unity, connection, or even being in the zone. Um, there is a term called attunement, which means to bring into a harmonious or responsive relationship to each other. In massage therapy, rapport is another term that can be used to describe the concept of attunement or being in the zone with your client. But if you're focusing on your own personal problems, you're focusing on yourself and not the client or the give and take in this therapeutic relationship. There's a really cool thing that scientists have discovered, these cells in the brain called mirror neurons that do support human connection. It goes much wider than this, and it definitely plays into the old saying, practice makes perfect. But in the case of the therapeutic relationship with massage therapists, mirror neurons play a role in the imitation necessary for learning and the ability to empathize with others. An important aspect of the professional relationship is understanding the condition of another person while remaining non judgmental towards them. All right. The amygdala is part of the brain that underlies empathy and allows for emotional attunement, all right? Facial expressions, voices, gestures, body movements, these all transmit emotions. We're going to talk about body language and nonverbal communication quite a bit more when we cover communication in our lectures next week. But humans especially tend to subconsciously mimic each other. You see someone smile that you like, you smile back at them. If somebody is crossing their arms or starts to cough or adjust, you start to do that too. You mimic their body movements when you are having a conversation with them and are face to face. Any postures, vocalizations, movements, when you are interdependent of each other, or if there is a survival relationship of some type, you will mimic someone else. So the amygdala, our lizard brain, has kept us surviving for thousands of years. This mechanism allows us not just to see an action that someone else is doing, but to interpret what it means. If someone's glaring at us, are they angry and potentially about to attack us? If somebody is smiling, does that mean that they're happy and perhaps are going to act more favorably towards us? The therapeutic relationship is grounded in these concepts where we are constantly looking for nonverbal and verbal cues from our clients of what's going on. We've talked before, about clients being uncomfortable, maybe holding their breath or breathing faster if they're getting excited in the case of an intimate situation. Or they could start tensing up their muscles, or they may move away from you if you're doing a pressure or movement that they don't like. These are all ways that you can watch them and discern how they are feeling by only looking or feeling their body. If the client's personal situation, now that we're going back to attunement, is similar to that of the massage practitioner, especially with regard to like life challenges, Maybe, you've had similar relationships, situations with children, maybe work problems, that type of thing. The practitioner might start subconsciously offering advice, which more pertains to themselves rather than the client. Number one, you shouldn't be giving advice to the client. Again, you're a touch therapist, not a talk therapist. But in these situations, when your life is similar to that of your clients, sometimes you'll start giving advice to your client that doesn't really work for your client, but it works for you. You start giving yourself advice by telling it to the client. So, this is something that you absolutely need to watch out for in the therapy session. This dynamic can be extremely detrimental to the client because it breaches the professional relationship and it fosters psychologically unhealthy behaviors between the massage practitioner and the client. You get an environment of sympathetic dependence, all right? This dynamic is a basis for countertransference, all right? So you've got a client who's coming to you for physical help and potentially as well as emotional and intellectual help, and now you're using them as a sounding board for your own personal issues, which is incredibly unhealthy and also breaches multiple professional boundaries. Practitioners also personalize the professional relationship when they assume too much responsibility on the outcome of each session or for when they project a personal situation onto the client process. To break it down simply, if a client tells you at the end of a session that their neck pain doesn't feel that much better, and then you get really disappointed in your own ability, or maybe you think that, the client just isn't accepting your treatment, or if you personally, as a massage therapist, have quit drinking coffee because you realize all the chemicals being added into it, whatever, and you've been encouraging your client to stop doing it because of lactic acid buildup, and they just can't switch to tea because they don't like the flavor or they just don't want to do it for whatever reason, and it starts to make you personally angry because this is a suggestion that you have been making to this client. All right. These countertransference issues usually reflect unresolved issues that the massage therapist is having themselves. All right. It can point out areas that a practitioner really ought to get professional help to get resolved before they continue bringing this out and putting it on to clients. It's important to remain as objective as possible in the massage therapy office. The goal is not for you to be flawless, but you need to maintain professional boundaries and be aware how personal challenges can interfere into your therapeutic relationship. All right, so some examples of countertransference. This could be feeling a strong emotional charge, either positive or negative, towards a client, feeling irritable or angry with a client for not changing their behavior, not improving throughout the massage process, or not cooperating with the treatment plan, like some of the homework you may have given them in terms of stretching or self care at home. Distorted thinking about a client, having an idealized view of them, or feeling very negatively towards the person. I had this happen to me once. I had a very significant countertransference issue. There was a particular client that would come into the chiropractic clinic I worked at shortly after graduating, and this person gave me hardcore serial killer vibes to the point that I was considering lying about my schedule to avoid working with this person just because I had extremely intense negative feelings and this abject feeling of terror when I saw this person, and they had not done anything inappropriate towards me. They had not said anything inappropriate towards me, nor behaved in a way that I could definitively say was in any way, shape, or form aggressive or inappropriate. And I still absolutely did not want to touch this person. So that's an example that could happen. Distorted thinking about your work in relation to a client, believing that your work is much better for the person than most practitioners' work, or that your work is totally ineffective and worthless for that person. This can be true, and it can also be transference. If you are someone that specializes in a couple of different medical type, or you're really focused on like sports, and someone just really wants like this long, luxurious oil and salt scrub, you need to refer them out because that's not your area of specialty. This is a little bit different. This is you believing that you just absolutely cannot work on someone doing the same type of treatments that you do to other people. A pattern of feeling exhausted or exhilarated, depressed, or uneasy when seeing a particular client, or recurring themes such as frequent sexual attraction to clients or the recurrent desire to make friends with clients, that's probably an unmet need in your personal life that is being fulfilled by the impression of intimacy that is occurring in the massage office. You can also have the expectation of praise and getting extreme disappointment when clients don't praise your work. You can feel really guilty when a client experiences a painful reaction that lasts for an extended period after the treatment. I mean, if this is something that you did due to negligence or harming them, feeling guilty might be normal, but feeling extreme guilt aside from your accident or whatever occurred is considered countertransference. Frequent experiences of anger when a client crosses minor boundaries, all right? Not major boundaries, not like a boundary violation, but just a slight boundary crossing. They question your competence or otherwise pushes your buttons. This can really get underneath your skin, and if you're allowing that to happen rather than being confident in what you're doing, this is another sign of countertransference. Undergoing secondary trauma upon hearing painful stories about a client's past. This could be triggering painful emotional memories for you. And this is something that we're going to talk about when we discuss trauma care, trauma informed care. All right. Frequently helping a client in matters outside the session, such as offering rides or introducing the client to social contacts. Please don't do this. This is outside of your scope of practice. Even if it feels great, you can refer them to other professionals that you feel that they could benefit from, but do not start stepping outside the therapeutic bounds of being a massage therapist to them. Then you start to muddy the waters and you are looking at potential serious ethical dilemmas. All right, so how do we manage transference and countertransference when we find it occurring? So, transference can be expected usually in some form, usually very minor, in the therapeutic relationship. When it comes up, as always, it is the massage professional's responsibility to reinforce the boundaries of the professional relationship. Help them redirect the transference activity to the appropriate people. All right. They're attracted to you. They need to go date somebody. They have emotional issues. They need to seek out mental help, counseling, something of this nature. They're having physical things that are beyond your scope of practice. They need to go see a doctor or a physical therapist. All right. If they do not move through the transference stage to a more self directed form of getting resources, either internal resources or external, like a doctor or a counselor or a date, and their coping strategies aren't working for them, then you probably need to refer them to another massage therapist. You need to disclose why you're referring them to the other therapist as well and to the client to help them understand that the boundaries of the professional relationship are being breached. They are acting in an unacceptable manner and it has not stopped. The existing situation is inappropriate and it could potentially get you into legal trouble. I've said it like 6 times in 20 minutes, but the professional is always responsible for self-monitoring for the development of countertransference issues and for seeking supervision or professional support and for keeping professional boundaries upheld in the therapeutic relationship. All right. It is a breach of professional boundaries to allow countertransference issues to develop or to linger or to be acted on. Peer support by other massage therapists, your coworkers, your friends that are massage therapists, support groups out there, professional affiliations, supervision, your supervisors or mentors, even past teachers are important for the massage professional when trying to figure out how to deal with transference and countertransference. Lean on other people, a support network to help you. Supervision and mentoring truly support professional development. Getting help from someone more experienced is going to do nothing but help you in your future career. Don't be afraid to ask for help. Don't have that rigid boundary that we talked about in the other lecture. Have a permeable boundary, but have that flexible boundary. Be independent. Reach out for help. Peer support is also important. When you interact on a regular basis with other massage practitioners, you can create healthy work practices by learning new information from them that they've picked up on, and they can help you solve interpersonal dilemmas with your clients. But when you do talk to these people, make sure that you are absolutely keeping the confidentiality of your clients. If a client wants to tell you a personal story in the massage office, listen respectfully, but avoid giving advice or asking for any additional information. You're a touch therapist, not a talk therapist. Questions should be limited to information that relates to your massage session. Make sure that you are respecting their boundary with your own self disclosure, and that you are making sure that they are respecting your professional boundaries within this massage session. Again, you are responsible for setting those professional boundaries and maintaining them. Even when clients are extremely talkative and tell you a lot about their personal life, they really don't usually want to know that much about yours. If they ask personal questions, it's usually because they're just trying to be reciprocal and they're just trying to be nice to you, or they're attempting to get comfortable with the situation, especially when it's really early in the situation and they want to know who's touching their mostly naked body. Like, what kind of person am I coming in to see that's touching me in this intimate setting? All right. When a client pays for a massage, the agreement that the time that you are spending with them is all about the client, not about you. You don't generally go into a counseling session to sit down and pay the counselor and hear a story about their childhood. You're there to talk about yourself, while the client is there to get massaged by you, not to hear your life story. Okay. Do not talk about yourself unless you are providing information about something going on with you that may affect the massage, okay? Maybe you have allergies and you're sniffling and coughing. And if that's going to be disruptive to the client, if you're coughing that much, honestly, you shouldn't be massaging. But if you are having a slight issue that might be disruptive to the massage, but doesn't actually warrant you canceling the massage, that's something that you can disclose. But if it is something that is about your personal life that shouldn't affect the office, absolutely keep it to yourself. Again, I'm sure you can already say it for me. You are responsible as the massage therapist to maintain those professional boundaries.